Hi, I am Tiffany and I will be performing tracheostomy suctioning today. It is February 17th and the video is about 2.5 minutes long. I already gathered my supplies, performed hand hygiene. I next then would identify the patient. We'll say Sarah Smith, September 1st, 1952. My supplies are already assembled. The door is shut, curtains are closed. I would then want to verify the reasoning for the suctioning, which would be because she has crackles upon auscultation. The patient is not in any pain. What I would want to do next is explain to the patient what I would be doing. I would explain that I would be inserting a sterile catheter into the tracheostomy and upon removal, apply some suction to remove those secretions for a more patent airway. I then would want to raise the bed up to a good working position. The patient would be in semi-Baylor's position because she's conscious, and I would lower the side rail down closest to me. What I would want to do next is put a drape across her chest. I do have a trash receptacle below. What I would then do next is apply suction, turn it on, no higher than 150. I then would want to put on clean gloves to test that suction. And the suction works appropriately. I remove my gloves and perform hand hygiene. After hand hygiene is performed, I then would want to open up my sterile supplies, remove my sterile container, making sure not to touch the inside of it. I would then want to remove the sterile gloves out of the packaging. I would want to place the sterile container in the other container and then pour sterile saline. I would then want to put on my goggles and mask. And then I would want to open up my sterile gloves. What I would do next is pick up the packings with the sterile catheter. My right hand is going to be my clean, sterile hand, and my left hand is what's going to be controlling the suction. So I would want to start by, excuse me, applying the suction to the catheter and then coiling this around my dominant sterile hand. I would want to then dip the catheter into the sterile saline to test it. It's working appropriately. The next thing I would want to do is remove my patient's oxygen mask and hyperoxygenate for at least 30 seconds. 1, 2, 3. I then would insert the catheter without applying suction to the predetermined length. Upon removal, in circular motion, apply suction for at least 10 to 15 seconds. Then we'll hyperoxygenate for at least 30 seconds. Apply oxygen. I then would determine if my patient needed additional suctioning. She does not. I would then rinse, rinse. I then would want to suction her mouth. I then would want to perform oral hygiene. Because the suctioning is complete, I would coil this catheter in my dominant hand and disconnect. I would want to remove glove. And dispose in the appropriate receptacle. I then would want to perform hand hygiene. I would lower the bed back down to a good working position. I would want to raise that side rail back up. I would want to then turn off my suctioning and remove my goggles and mask. And I'm just going to set it right here for the video purposes. I then would want to reassess my patient, listen to her lung sounds, tracheal sounds, make sure there is good depth and rhythm. I would want to make sure her pulse ox looked good, make sure there were no secretions noted anymore, that she has a patent airway. I then would want to make sure she tolerated the procedure well, and she did. The next thing I would want to do is apply hand hygiene. Thanks.